You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Go ahead, Brandy.
Lucy says, at night my feet tingle and it's hard to fall asleep. What is that from?
Yeah, so that's two main reasons. One would be neurological, such as an actual compression. Sometimes when you lie down on your back, it can cause a little bit of a compression on those big sciatic nerves, which can cause a little bit of tingling. The other thing is it's metabolic, which is more likely. Unless you have a history of an injury or spinal history or stenosis or something like that, which is definitely possible, then it could be metabolic. So then it could be B12 is for sure. One of the most important things I would do for that would be B12, no question. And then you also want to do, as my dad mentioned earlier, raise nitric oxide levels. So I would use something like B12 will help with that, but I would use something for endothelial dysfunction. So I would use something like our Navital, which has pine bark extract, which is very good for that. And then I would use, again, for conduction regions, I would use stuff like DHA, and those kind of things. But those are the two usually the main causes for that.
Yeah.
Anything else, Ted?
It's usually a sign you're on the Titanic.
Yeah, 100%.
Because if it isn't like Tony Jr. said, if it's not coming from your spine or mechanically, it's usually, even those early neurological things are often metabolic. And guess what?
Yeah, that's
a metabolic syndrome. Change your diet and do all that stuff.
Yeah. Because that could be an indication that you're becoming diabetic or you have some kind of neuropathy going on. Go ahead, Brandy.
Angie says, I just had a stomach scope and they are doing a biopsy for H. pylori. It shows I have stomach irritation. What do you recommend besides probiotic? I follow keto for years.
Yeah. So my dad will have a lot to say on H. pylori in a minute. What I would recommend are something. So for irritation of the stomach, you want, again, irritations don't just spontaneously show up, right? Something over all this time has to be creating an irritation in the gut that they can actually see that on a scope of some kind where they can see the inflammation. I like things like mucilages, stuff like slippery elm bark, like marshmallow root extract. Those are the things that we put in our IBS formula because it helps coat those kind of things, right? Some people like aloe vera for that kind of stuff. There are things that you should be doing, but again, figure out what that irritation is from, what's causing it. And my dad, I'll let you talk about H. pylori because you've
H. pylori, probably, if the truth be known, it's about 90% of the population already have it. It just sits there and is very dormant most of the time. If it gets activated, it can create ulcers and other things in the stomach. But again, H. pylori, it just doesn't come out of nowhere. Usually I find, and this is just me, I find that, if you're not a good eater, you're much more susceptible to get H. pylori. It has everything to do with your digestive tract. Insulin has a major effect on your digestive tract. Cortisol has a major effect on your digestive tract. Stress, it's amazing what stress does to suppress your immune system and your digestive tract.
Yeah.
So, look, you're doing the right thing with probiotics for sure. Change the diet. Look, if you have to take like sometimes a doctor will put you on antibiotics, just make sure that if you do get antibiotics for H. pylori, I don't particularly like it. Not that I'm against antibiotics, but for H. pylori, I don't like it. I'd rather you do it in a natural sense. Look, our digestive enzyme has oil of oregano, and it has thyme. You know what? That'll kill the H. pylori. I mean, it's made for that. So I'd rather you do it naturally. But listen, if you do take an antibiotic, then make sure you're doubling up your probiotics so that you don't get a fungus, candida, or whatever afterwards. But look to the things that we just talked about.
Now, what's interesting is that, so when the MRI unit was first discovered and people were starting to get MRI for everything back pain related. What happened was they ended up doing a ton of surgeries because everybody had a bulging disc. And so they did a lot of surgeries after. And then what was happening was these people were still having back pain. Because what they found out after doing a lot of MRIs is that most people have some kind of a bulging disc that's asymptomatic. It's just normal for them. H. pylori to me is one of these things that a lot of times when they don't quite know what's going on with the stomach, because almost everybody has H. pylori, they start blaming it for everything. And then they go and kill something that may not even be a problem in the first place. I think H. pylori would be one of those things that we look back on and say, for most people, asymptomatic, no big deal. That wasn't the cause of their symptoms. But in the meantime, this is where we're at when it comes to H. pylori. But it reminds me of the MRI unit when it first came out a long time ago. All right, go ahead, Brandy.
Angela says, what do you suggest is a good combo to be proactive to colon cancer?
To be proactive for colon cancer? Like, do they have colon cancer or they don't want to get colon cancer?
It doesn't say, just proactive.
So colon cancer is on the rise big time.
Big time.
Huge. It's on the rise big time. It's one of those cancers that's just like skyrocketing. And which, again, if you look at what's changed in society ever since the colon cancers and all these kind of cancers that have come up, like lung cancer, there's not more people smoking. There's less people smoking, and lung cancer is on the rise. Why is that? Because it has to do, again, with high circulating insulin. For a lot of these cancers, it's high circulating insulin that's causing a free radical damage to these parts that's destroying the mitochondria, creating inflammation. If you look at the colon, in my opinion, it's high circulating insulin that's causing a lot of it, and these crappy, undigestible vegetable oils, processed foods. So to be proactive, food-wise, if you control your insulin, you stop eating all a diet high in this crappy vegetable oil stuff, and then you make sure that your bowels are healthy with probiotics, make sure your food's getting digested with digestive enzymes, and you exercise, and your stress level's okay, you're controlling cortisol. To me, that's the best way to be proactive when it comes to a lot of cancers.
Yep.
Go ahead.
And the gut, vitamin D.
Vitamin D, yeah, 100%.
It's just a common denominator on all cancers. All cancers.
Yeah.
People have very low levels of vitamin D generally in the world today. Very low levels. Why? The boogeyman is the sun.
Yeah, we're scared of the sun. All right, go ahead, Brandy.
Anne says, I don't have a gallbladder and take digestive enzymes with bile in them. Your digestive enzymes don't have bile. Would they still work for someone without a gallbladder?
Yeah. So ox bile extract is which a lot of people take, is just one way to do things, right? We built our probiotic formula, our enzyme formula a little differently for reasons, but yes, 100%. There's no question. And a lot of times, obviously we're huge fans of our digestive enzymes. We've, over the years, we think have almost perfected a good formula when it comes to it because of the effect poor enzymes have in terms of leaky gut. So we have a kind of a combination of stuff in there. But if you're feeling good on a digestive enzyme, that's awesome. That's for sure, go on, but no, you can take our enzymes. It will help for sure.
Yeah. And, you could go down a whole rabbit trail of why we see so much gallbladder problems today. Again, it's an epidemic.
Yeah.
And, there's a lot of reasons, and women, it's almost 90 to 10%. 90% of people that get their gallbladders removed are women.
Yeah.
Well, there's a reason for that. And, and a lot of it is nutrition, by the way.
Yeah. A lot of it is insulin affects their estrogen, which affects their, progesterone, gallbladder, that whole connection.
Yeah. And they don't eat enough fat.
No. And that's
your gallbladder is a reservoir for bile.
And it's
It's
made
just
to
a little,
exercise. It's
you
made to
know,
be used.
yep, meant to be used.
Yeah.
And we don't use it. Women in your chicken and salad.
If you know what, it's amazing.
Brandy.
Yeah, what's amazing is that a lot of times the body works on a principle: if you don't use it, you lose it, right? The body, you see that. That's why, like, you know, it used to be that if somebody broke a leg or something, they were casted forever, and then you take the cast off, and one leg is a quarter of the size of the other, right? You had this massive amount of muscle atrophy going on. So now, even with surgeries, now they get people up moving quickly, because if you don't use it, you lose it. It's the same thing. The treatment of injuries is way more aggressive today than it used to be, because it needs to be. The body responds to that much better. It's the same thing with organs. When you don't use an organ for a while, or your dietary way of eating kind of eliminates the use of that organ, well, guess what happens? That organ breaks down, it gets defective, it starts to back up, it has all these issues. And that's a big issue when it comes to gallbladder for a lot of people. And the end result of that is when they do start to switch their diet around or something, their gallbladder just starts to give them a whole whack of issues. So, but to answer the question, yeah, our enzymes can help with that. Go ahead, Brandy.
Beverly wants to know your opinion on chronic pancreatitis.
Well, good. I'm glad you asked, because I was gonna, if you guys would have allowed me, I would have talked all things gallbladder. But remember, with your gallbladder, it's got a duct going right into your pancreas. And, you know, like the pancreatitis, that's another thing we see. It's incredible, the amount of pancreatitis and even pancreatic cancer, which was so rare 50 years ago. It was like it never happens. And today, like, it is a scourge in society. But pancreatitis is, you know, when I talk about, you guys know my expression. So when I say, when you're fasting without fasting, you know, by doing the reset, you're sending your pancreas to Hawaii on a holiday, okay? I tell that. You give it a 30-day holiday. Because when you're not eating crappy carbs and sugars, your pancreas, it's not like it's not working. It's just, it doesn't work any overtime at all, and it gets its rest. The problem is we eat too frequently. I mean, that was an old, you know, you got to eat every couple of hours, and we eat too frequently. You're always secreting insulin. We're eating crappy carbohydrates and sugars, and the pancreas is paying an enormous price. It creates enormous inflammation of the pancreas, and it affects your liver. It affects your gallbladder. And so it's food, man. It's food.
You know, it's funny because we get this question a lot as well about, you know, because at one point people pretty much ate 3 squares a day is pretty much what they ate. And then, you know, a little bit of snacking here and there. And then, you know, I'm sure in my head, I picture like this, but this is not how it happened. But I just picture like an emergency meeting of all the head CEOs of every food corporation saying, listen, how do we get these guys eating more? So then they say, hey, I got a great idea. Let's convince them that if they eat 6 times a day, it keeps their metabolism going all day, and they'll burn fat all day if they can eat. So they manage to convince people if they eat all day, it's better for them, right? I mean, it's like, we get this question about fasting. It's like, well, is missing a meal bad for you? Like it's so funny, right? That's the mentality that we have. It's like, eat more often is good for you. If you cut out a meal, that's bad for you, right? Like somehow that's got into our way of thinking. But when you, on the one side, if you don't use it, you lose it. On the other side, if you have repetitive strain injuries for a reason. The body, you can overuse things as well. And the pancreas is definitely, in the last 20 years, have taken its lumps. There's no question.
300%. We did this, Brandy. I don't know if you remember, but we talked about childhood fructoholism. And the reason is, in the last 20 years, there's been a 300% increase in the consumption of fructose amongst children, but not just children.
Yeah. All right, Brandy, go ahead.
Gail would like to know, what do you consider to be a healthy level of CRP and TSH?
CRP, which is the measurement for inflammation in the body. There's C-reactive, they call it C-reactive protein, and TSH is a testing. It's a hormone for thyroid. Specifically, she's asking the numbers that we like to see.
Yeah.
Well, thyroid, to be honest with you, we always ask the thyroid questions, because if you were to, and this is something that most people are fascinated when they learn, do you know how much you secrete in a full year? If you were able to secrete a full year's worth of thyroid hormone, most people are shocked to learn how little that is. It's not, you secrete nothing. It's so
teaspoon,
tiny,
right?
a teaspoon in a year to control all the thyroid, which is your master gland, secretes about a teaspoon of thyroid hormone in a year, and that controls all your metabolic processes. So the testing is very sensitive, and the testing can mess up a lot, which is what happens a lot of times in people going and getting their TSH. So again, to be honest with you, because one of the biggest problems with that kind of testing is that people have thyroid symptoms, but their testing is normal. So we will always listen to symptoms first, because symptoms tell the story for people, and the testing may not be there. Plus, when it comes to thyroid testing, you can have 7 years, and this is research has shown this, 7 years of subclinical hypothyroidism before any numbers show up. So you can have 7 years of symptoms of hair thinning, hair falling out, weight gain, low energy, fatigue, dry skin, all those things for 7 years before it shows up. So we're not huge on the TSH when it comes to what's the actual amount, because and that number can vary. It's like testosterone for men. Some people do well with 500 500. Other people need 1,200 to feel good. So that number varies as well a little bit, in our opinion. Now, I don't know if you have a specific number, Dad, that you look at from a functional
not
standpoint.
the TSH. I just as soon not see it, to be honest. I mean, they can send it to me, but it don't mean much.
No, it's
I want to know what your symptoms are, because then it's much. But let me just say something about here. I just read you a study that I was actually going to talk about this morning, but I never got off COVID. The relationship between estrogen and progesterone can disrupt the thyroid function without presenting any abnormal TSH levels. So you see, your thyroid. I love what you've said, Junior, many a time about the thyroid. It's like a puppet. It's not independent of your adrenals. It's not independent of the ovaries, especially in women. It's not independent of your gut. We talked about that. The CRP is a C-reactive protein. Unfortunately, in medicine, they usually only use it to look at autoimmune disease. And therefore, the range is, I think if it's under 5, it's in the normal range. The problem with that is, like, if you look at inflammation, because CRP is a tremendous inflammation marker. And if you look at that number, I like it to be much lower than that. I like it in the 1, 0 to 1, because then you have very little inflammation in the body. But medicine hasn't really caught up yet to this whole inflammation thing being a very important factor. They look at it more, like I said, in autoimmune, like lupus or rheumatoid arthritis or whatever. So try and keep your CRP really low, because then you do better cardiovascular wise, cancer wise, and every other reason to keeping inflammation low.
Yeah. All right, Brandon, we got about 5 minutes left. So if you want to fire away.
Anonymous is on day 18 of the reset and feeling uric acid, gout in left toe, drinking lots of water. What else can I do?
Well, that's a metabolic thing. Trust me when I tell you that you're doing the right thing. Sometimes when you lose weight, you get gout.
Yeah,
they can't even tell you the process of why that happens. But I can tell you that you're fixing your metabolism. You're taking stress off your kidneys and uric acid. You're going to fix it. So for a small percentage of the people, when they lose weight, they can get an attack of gout.
Yeah, especially if they have a history of gout.
Yeah,
right?
especially if they have a history of it. So just remember, the best way to fix it is to do exactly what you're doing.
Yeah.
And you're going to clear up the actual cause is what you're
And
clearing up.
Also you might be the small percentage of people that actually do have a problem with purine metabolism. So that might be something else. But most times, like as we've mentioned before during these Q&As, most of the time it's a fructose issue, a sugar issue that's causing the gout. And sometimes when you lose weight, it can do it. If it doesn't seem to get better and you're eating this way, then you may want to look at the purine aspect of things as well. All right, Brandy, one more question and then we'll call it quits.
Merv is asking, will taking statin drugs for a few years cause problems with the bladder, such as leakage?
I can't say I've heard of that. Have you?
Yeah, I'm just
Tony
trying to think
Jr.?
if there's a mechanism
the bladder.
Well, look, again, cholesterol is an important function of cell health. First of all, right? Your cells need cholesterol to be healthy. Your cell walls need cholesterol to be healthy. Can artificially lowering cholesterol production cause an issue in bladder? That's interesting. You don't hear of it often. Usually the symptoms more around the brain, more around if it's a guy, testosterone levels, if it's more that kind of stuff, sore muscles especially. Can bladder's I guess. Why not?
Yeah. I haven't heard of it.
No,
but I guess it's possible.
Yeah.
And remember, go back and talk about CoQ10.
Yeah.
If you're on statin drugs, you better be on CoQ10.
So bladder, sure. I would increase DHA quite a bit. I would take a lot of DHA. Bladder is surprisingly good for people. Are always shocked to learn when they take DHA how good it is for their bladder, how good it is for their eyes as well. A lot of people fixes dry eyes. And then I would increase DHA. I would increase curcumin. I would increase Navitol. That's how I would deal with a bladder thing going on. So, all right. Well, we're out of time. Again, we had an awesome time. This is a lot of fun. The questions are always fun. We enjoy answering questions. And we're going to try to do this every week. We may skip a week here and there, especially as the summer's coming along. But we'll try to keep on doing this. Dad, you'll do a Q&A live tomorrow. So you'll answer some more questions with that. And again, we want to thank everybody for joining us. We have a blast. We'll see you again soon. Thanks a lot.
You've reached the end of another Dr. is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.